Hello friends, in the second part of pharmacoeconomics, in this part we are going to see the different definitions which are commonly used in the pharmacoeconomics. So let us see these definitions. The first definition is economic evaluation. Here the comparative analysis of at least two medical treatments used to assess both cost and consequences of different technologies in given population, providing decision framework. So here are two components, एक है cost and second is outcome of the treatment. Second definition is target population. Here a group of patient or subgroup who will benefit from the health intervention or treatment, that is called target population. The interventions being compared in the economic evaluation, example drugs, vaccines, medical procedures, services, etc., are called as comparators. The context in which the health intervention is occurring, that is called as a particular setting of the health intervention. Perspective is a viewpoint of the patient, provider, payer, society, which provides the health benefit and cost that can be assessed. Time horizon, the duration over which cost and outcomes are calculated in economic analysis. So that compares the benefit and the consequences of that particular health intervention or treatment. Opportunity cost is that kind of cost actually which is foregone benefit that would have been derived from the option that are not chosen during the treatment. Willingness to pay, a simple meaning is there. The person who is willing to pay for the health intervention or the treatment. The process in which individuals are asked to maximum they are willing to pay in the monetary terms to achieve the given benefit of the intervention or service. Discounting is a method used in the accounting for individual's time preference, in which individual expect the positive rate of time preference, benefits are expected earlier while cost expenditure is done later. Modeling, it is a decision analysis in which a model is set in order to make decision tree or the simulation model. Sensitivity analysis, it means representing uncertainty of the result of economic evaluation. Cost, it refer to the monetary component of the economic analysis. It can be divided as direct, indirect, medical and non-medical, and intangible or tangible cost. Outcome, it is also called as benefit or the consequence. The outcomes are expected healthcare or humanistic results from the intervention. Then we'll see the methods of economic analysis. So there are basically four methods that we use to compare the cost, clinical, humanistic outcome that are associated with the different therapies. The evaluation mechanism is delineated, are often useful in demonstrating the cost impact of the innovative treatment, granting greater acceptance by healthcare providers, administrators, as well as public. So we'll see one by one these different methods. First is my cost minimization analysis, in which we try to reduce the cost for optimal utilization of the cost. Say there are two drugs A and B. One is costing $3,000 and another is costing $2,500. The benefit in terms of life years is 2.5 from the both drugs. So in that case we'll prefer the B drug as it has less cost as compared to the A. So it shows cost saving of treatment program over the another drug. So it aid in the formulary decision making, in which we can include or exclude a particular drug in the hospital formulary. Second method is cost effective analysis, in which we compare the strategies on the basis of the particular currency that we are utilizing per physical unit of improvement in the clinical outcome, like say life in years that is gained, or the of Hg blood pressure reduction with a particular treatment. So cost effectiveness ratio can be calculated by the formula net cost of intervention divided by net change in the health effect. So this cost effective analysis is useful in comparing the cost with health outcome for individual patient. It provides the data to endorse drug policy formulary system, in which individual patient treatment decisions can be taken. Cost benefit analysis is uh, especially translation of outcomes of interest into monetary units. Example, say dollar, if currency we are using, used primarily to make resource allocation. That decisions can be taken for allocation of different resources when effectiveness of intervention does not need questioning. The net benefit can be calculated by using formula net benefits minus net cost. So if net benefit is greater than 0, then the particular treatment is cost beneficial. So it is mainly useful at macro level for policy decisions in the healthcare system. Next and last method of the cost benefit analysis is cost utilization analysis, where the comparative strategies are designed on the basis of dollars per unit of health and adjusted for preferences or the quality. So cost or quality ratio is equal to cost divided by quality of adjusted life in years. So this kind of analysis is useful for comparing the treatment programs with different outcomes and various health programs. The basic goal is to improve the quality of a life of particular patient. Okay, so all these are definitions you go through. Thank you. That is all for today. Thank you very much. We'll meet again with another topic. Thank you.